Order. I call this meeting of the Standing Committee on Health to order. My name is Suzanne Lonis-Croft. I am the MLA for Lunenburg and Vice Chair of this committee. Today we will hear from the Nova Scotia Lung Association, the Canadian Cancer Society, and as a guest of the Cancer Society, a representative from the Heart and Stroke Foundation. They will be discussing youth smoking and vaping. Please turn off your phones or put them on vibrate, and in case of emergency, we'll exit through the back door and down the hill to Hollis Street and gather in the courtyard of the Art Gallery of Nova Scotia. This is a little change from what we were practicing before. As the committee member, I will ask the committee members to introduce themselves, starting with Ms. Martin.
Thanks so much, and thank you for coming. Tammy Martin, MLA, Cape Breton Centre.
Good afternoon. I'm Susan LeBlanc, MLA for Dartmouth North.
Good afternoon. I'm Barbara Adams, the MLA for Cull Harbour Eastern Passage.
Good afternoon. My name is Colton LeBlanc, the MLA for Argyle Barrington.
Hi, and good afternoon. I'm Margaret Miller, the MLA for Hants East.
I'm Ben Jessam, the MLA for Hammonds Plains Lucasville. Excuse me.
Welcome to the legislature to all our guests. My name is Keith Irving. I'm the MLA for Kings South.
Hello and welcome. I'm Rafa Di Costanzo, the MLA for Clayton Park West.
Our topic today is youth smoking and vaping. I welcome our witnesses today, and I will ask, beginning with Ms. Cull, to introduce themselves.
Hello, my name is Kelly Cull. I'm with the Canadian Cancer Society.
Rob Cunningham. I'm a lawyer and senior policy analyst with the Canadian Cancer Society.
Pam Fonseca, Health Promotion Manager with Heart and Stroke.
Robert MacDonald, President and CEO of the Lung Association of Nova Scotia.
Dr. Mohammed Al-Hamdani, Executive Director of Smoke Free Nova Scotia.
Thank you for your introductions. We will have our opening remarks from Ms. Cull and Mr. Cunningham. I will ask for Ms. Cull to begin.
Hello. Thank you, committee, for the invitation to speak today. My name is Kelly Cull, and I'm here today representing the Canadian Cancer Society. 20 years ago, Nova Scotia's youth smoking rate was 30%, and over 2 decades, remarkable progress has been made on tobacco control, a result of education, policies, and programs. Despite this progress, tobacco remains the single most preventable cause of cancer death in Canada. 45,000 Canadians are killed each year from tobacco use. A recent Canadian study revealed that in 1 year, vaping among youth skyrocketed 74%. The youth vaping epidemic is resulting in a new generation addicted to nicotine with dire health consequences. Urgent action is needed. Party lines must be set aside. We must work together to stop this youth vaping epidemic. Before we talk about the path of what needs to be done, I'd like to talk about the destination. There is a movement afoot in Canada called the Tobacco Endgame. The end game is the reduction of tobacco use to less than 5% by year 2035. We aren't talking about tobacco control anymore. There is no upside to this product. There is no way to consume it in moderation. It literally kills over half of its users when it is used as intended by the manufacturer. This goal of an end game is a critical pivot point for this conversation today. The current e-cigarette trend with a new generation of teens addicted to nicotine poses a severe threat to eliminating tobacco use or reducing it to 5 by 35. We need to start with the end in mind. Where do we want to be in 15 years with respect to youth tobacco and vaping? And we need to work back from there. With tobacco, the goal is clear. It's 5 by 2035, with a youth smoking rate that is even lower. With respect to youth vaping, the goal should be even more bold. 5 years ago, most high school teens didn't even know what an e-cigarette was. We need to turn back the clock. So, how did we get there, and what do we do? With respect to the first question, how did we get here? Aggressive marketing, youth-enticing flavors, innovative design, and highly addictive levels of nicotine on the part of the industry. Combine that with a lack of sufficient oversight and regulation on behalf of successive governments. Governments prepared well for the legalization of cannabis, but not for e-cigarettes. What do we do now to protect youth and non-smokers from taking up vaping? And how do we build on our success around tobacco use? We need a comprehensive approach for this province, a strategy that puts everything on the table and addresses every aspect of tobacco and vaping. Specific to addressing the youth vaping epidemic that we face today, the Canadian Cancer Society proposes the following. First, restrict e-cigarette flavors. There is no justification for the thousands of flavors that could be available on the market in Nova Scotia. The red tab of our binder showcases some of the flavored e-cigarette products recently purchased in Nova Scotia stores. In 2015, Nova Scotia became the first jurisdiction in the world to ban menthol and also ban flavored tobacco. Premier McNeil's government has the chance to take another leadership stance by restricting e-cigarette flavors. In this regard, I would also like to commend Tim Houston on his private member's bill. Nova Scotia has regulatory authority to restrict flavors. Several states and the U.S. federal government are in the process of undertaking flavors bans and restrictions. Nova Scotia should do the same. Note that in the U.S., Juul has stopped selling flavors except tobacco, menthol, and mint. In Canada, menthol should not be allowed, given the menthol cigarette ban. Second, ban sales except in adult-only specialty vape shops. Regarding this, we would like to commend Tammy Martin for her private member's bill. The current system is clearly not working. Youth are getting access. Cannabis is not sold in convenience stores and gas stations, and neither should e-cigarettes. We would also like to recommend that all stores selling tobacco or e-cigarettes have a sufficient annual license fee. The pink tab of our binder outlines license fees across Canada. Third, ban internet sales. Quebec has done this by requiring that all sales be face-to-face. Banning internet sales would reduce youth access and help enforce flavor restrictions. Fourth, establish regulatory authority to establish other product standards in addition to flavors. There could be standards on appearance, such as no pink or other stylish colors. There could be a maximum nicotine concentration of 20 milligrams per milliliter, as the European Union has done. In Nova Scotia, Juul, Vape, and Logic sell e-cigarettes with nicotine levels of 59 or 57 milligrams per milliliter. These fuel youth addiction. Fifth, raise the minimum age for tobacco and e-cigarettes to 21. The Institute of Medicine report in 2015 concluded that raising the age from 18 to 21 across the United States would reduce youth smoking by 25% among 15 to 17-year-olds and 15% among 18 to 19-year-olds. Nova Scotians also support this policy. In 2019 polling, 85% of Atlantic Canadians indicate support for age 21 for e-cigarettes and tobacco. 18 U.S. states have implemented age 21, including Massachusetts and Maine, with a U.S. federal bill in process. Even Juul, the major e-cigarette company, publicly supports age 21. In closing, I would like to thank the committee for their time and interest in this critical issue. We look forward to your questions. And on behalf of the Canadian Cancer Society, the country's largest cancer health charity, we look forward to working in partnership with you to develop a healthier tomorrow.
Thank you, Ms. Cull. We will turn over to Mr. MacDonald for opening remarks.
I would like to begin by thanking the committee for the opportunity as well to be here today to present before you. To discuss this extremely important issue that could have impact on Nova Scotia's lung health for years to come. We are happy to be here with our colleagues from the Canadian Cancer Society, the Heart and Stroke Foundation, partners that we have worked together with for many years through our collaboration with Smoke Free Nova Scotia. And just for some clarification, we have a job sharing arrangement where Dr. Mohammed Al-Hamdani is the Executive Director of Smoke Free Nova Scotia, but he's also our Director of Health Initiatives for the Lung Association. At the Lung Association, we have taken an active leadership role in vaping and e-cigarettes since the inception of these products. And we believe that the time is now to enhance regulatory measures. While this is an issue with many complexities, we've broken it down to two main areas of focus, which are, one, how can we protect our youth from using these products? And the second, can these nicotine delivery devices be considered a cessation tool for those trying to quit smoking? Youth. It is no secret that these products have infiltrated our schools, our locker rooms, and our playgrounds in astounding numbers. Another generation of smokers is being produced, addicted to nicotine and inhaling chemicals into their lungs. These products are easily accessible to our youth. Vape shops have opened around junior highs and high schools. Social media advertising and an abundance of candy flavors have created a broad appeal with youth. Nova Scotia has twice the national average of youth who have vaped in the last 30 days. We as leaders need to protect our youth to ensure that their future is a healthy one. The tactics that have been used by the industry and the extreme societal pressures that youth face today have culminated in an epidemic. The Lung Association of Nova Scotia will not stand by while our youth become needlessly addicted to nicotine and potentially harm their health. In order to address this issue, we must look back at past experiences in tobacco control in which effective strategies such as banning flavored tobacco products, health warning labels, banning smoking in cars, and taxation were used. At that time, our organization worked in tandem through comprehensive tobacco control strategies with our partners and stakeholders, government departments, and the political leadership of the day. In many cases, Nova Scotia was the first jurisdiction to implement these regulations, and we should be commended for that. We have a reputation when it comes to tobacco control of being leaders, and I believe that this is another opportunity for us to prove that point again. Vaping as a cessation method. Currently, there's need for further research around the long-term harms and the effectiveness of vaping as a cessation tool. We'd rather take a cautious approach to lung health. We will continue to advise the use of evidence-based methods for smoking cessation, such as pharmacological aids, methods that have gone through a regulatory process. If the industry believes that their products is a smoking cessation aid, they should be regulated as one and have their product go through rigorous processes just like any other. Anecdotally, we have heard that those struggling with smoking have been able to reduce or quit their smoking, and we're very aware that this is an addiction. However, we will continue to encourage using evidence-based cessation aids to overcome this addiction. Our mandate is to protect the lung health of all Nova Scotians, and that includes those who smoke or vape. The issue of vaping is similar to smoking in several ways, and the lessons that we have learned from tobacco need to remain at the forefront of this discussion. I always wonder if we could go back in time when tobacco first emerged, would we have done things differently now that we have seen the carnage that this product has produced? From my discussions over the last year with all three parties, it's fair to say that all political stripes are in favor of being proactive and being leaders on vaping regulation. I look forward to the questions today and the discussion so that together we can make a difference in lung health in Nova Scotia. Action is needed and is needed immediately. Thank you.
Thank you, Mr. MacDonald. We will open up for questions, starting with the PC Caucus for 20 minutes. Ms. Adams.
Thank you very much, and I'm so grateful to all of you for being here today, and I actually think that your introductory statement should be required watching of all youth in our province as well as all of their parents, because I think the one thing that stands out for me is people don't realize just how deadly serious this issue is. And as a health professional, I know that we were winning the battle on smoking cessation. And I love the idea of having this 5% by 2035 because it's a measurable and achievable outcome. But I have, like you, watched with a sick feeling in my stomach just the explosion of vaping in our youth. And so I agree with you that anything that we can all do together to reduce this is important. So I wanted to start out with one of the things that you said. The Canadian rate for youth who vape rose from 6% in 2014-15 to 10% across Canada, but to 2016-17. But in Nova Scotia, the percentage of youth who vaped rose from 9% to 21%. So that's more than double the national average. So, and it doesn't matter to me who wants to answer. The question is, why is it twice as much vaping in Nova Scotia compared to the rest of the country? Why do you believe that we have twice the problem that other provinces have?
Who would like to take that? Dr. Al-Hamdani?
So, as you may be aware already, Smoke Free Nova Scotia has conducted a survey, detailed survey of youth and young adults, about 670 of them, all of which vape, and we tried to really understand why these youth are addicted to this product and why they're using them. Now, we've heard many things that may or may not apply to other provinces, but a few that really jumped at us have to do with flavors. So if you look at how many youth who vape say they prefer flavors, 96% of them say they do. And if you look at youth females specifically, who are between the ages of 16 to 18, they're telling you that the most important thing to them about vaping has to do with flavors. Another thing that is also worth noting has to do with nicotine. So if you looked at some of the findings of the survey, you'd see that 66.5% of youth, so we're talking about 16 to 18-year-olds, who used, who use nicotine-based products, said that they go for the highest concentrations of nicotine available. So the nicotine rush is a certain motive, and we saw that specifically being declared by youth males by about 55% of them. Now, these are some of the issues. Another one that might also explain why we're seeing these rates in Nova Scotia has to do with retail access. And to be honest with you, it came to me as a surprise, and I believe I can speak to my colleagues as well, that the #1 access point for vaping products is actually retail locations rather than online stores, which we thought would be the #1 point of access because there are minimal safeguards. But the thing is, about just over 33% of youth, underage youth, access these products from a physical retail location in Nova Scotia. The closest percentage that you can find in terms of self-reported access points is 17% for tobacco that I found for a study in Ontario. That's about twice as high. So we need to tighten up those retail locations, and we need to do that immediately. Now, I haven't done any research on other provinces specifically, but I've also looked into social media. Vape shops are very active on social media, and the survey has also identified an unacceptable level of exposure to social media advertisements, including ones through Instagram and Twitter. So there's a host of reasons that could explain the issue, but rather than focusing on what is contributing to doubling to the rates in Nova Scotia that are twice as high as the national average, it's important to focus at a few things that we can change and perhaps should be changed in order to better protect youth in Nova Scotia. And my colleagues at the Cancer Society have already touched on a few of them, including taxation, increasing the minimum age to 21, but flavor bans, but also capping nicotine levels because they shouldn't be that high, and certainly tightening up access through retail access points. So all of those may be helpful.
Ms. Adams.
Thank you very much for that. The last edition in Nova Scotia for our comprehensive tobacco control strategy was released in 2011, and we have not seen an updated strategy since that time. But we've had giant evolutionary steps in the smoking industry that include the legalization of cannabis, the introduction of the flavors in e-cigarettes, and as you said, the increased nicotine content, and the increased access around the province from just vape shops to every convenience store and gas station around the province. Something that Ms. Cull mentioned in terms of all of the strategies about the dealing with the aggressive marketing, youth enticing flavors, there was another statement combined with a lack of sufficient oversight and regulations on behalf of successive governments, and I'm assuming that's municipal, provincial, and federal, because we all have to do that. So bill number 167 that was introduced by Mr. Houston from Pictou East was to ban the e-cigarette flavors. And I noticed that the Smoke-Free Nova Scotia's recommendations that banning flavored vaping juices was the #1 recommendation. And I'm wondering if you can comment to those who are watching just how important the banning of the flavors would be in terms of reducing the incidence of youth vaping in Nova Scotia.
I think the numbers speak for themselves.
Dr. Al-Hamdani.
My apologies. I saw the red mic, and that was my cue. So I think the numbers speak for themselves. 48.3% of youth and young adults who vape said that they would quit vaping if we remove flavors. I think that's a very powerful self-reported statement from local data, from local respondents, that combined with the fact that, let's assume for a minute that flavors are very important to those who want to quit smoking, assuming that vaping might have some merit in terms of helping some people quit smoking, there is a smaller proportion of tobacco and vaping co-users who say that they would quit vaping if we were to remove flavors. That just shows that flavors are less important to those who are trying to quit tobacco use using vaping products. And if you're interested in an elaboration on the impact of smoking, vaping as a smoking cessation aid, and also the importance of weighing that against its tendency to lead to smoking initiation, I could speak to that if that's a question that you may have.
Ms. Adams?
Thank you. I think it's so important that people realize that the banning of the flavors would result in almost half of kids stopping vaping, which is really why we're here.
Ms. Adams, just a second. I think Ms. Cull had something to add to that. Did you? Would you mind her responding?
By all means.
Ms. Cull.
I wanted to pick up on a point that you were saying around the comprehensive strategy and Nova Scotia's approach on tobacco control. And as I talked about in my comments, the goal of 5 by 35 is really pinned on having a comprehensive multi-pronged strategy. And a lot of the success that we've seen in Canada around reducing tobacco rates to the extent that we've seen over the last decade has become because there's been this real kind of holistic view in how we come at this problem. Taxation, advertising, packaging, point of sale, all of those things have worked together to see the progress that we've witnessed. And I think that Mo has talked a lot about flavors. And the other thing I would want to bring your attention to is around the social sourcing of these products. For the vast majority of young people who are, or for a good majority of young people who are accessing these products when they're underage, particularly when you look at the younger age groups between the ages of grade 9 and grade 10, they're often less frequent users. They're in the process of developing a more sustained level of addiction, and their source of obtaining, whether it's tobacco or e-cigarettes, often comes from a friend. So what we call social sources. They access it from a sibling, a brother, or possibly someone who's legal age. When we talk about comprehensive approaches, it's really important that we address that social sourcing as well, which is really the foundation upon which we put forward this recommendation around age 21. We really need to get at how these products are circulating in the high school environment. Raising a minimum age to 21 really, it's not a perfect solution, and there are no perfect solutions here. Tobacco control is, or ending tobacco use is really a product of a number of things that work together to achieve results. But 21, we really believe, would take the legal purchaser out of the social circle, which in Nova Scotia's instance is the high school environment.
Ms. Adams.
Thank you very much for that. I appreciate that. One of the things that you referenced earlier was that Nova Scotia was a leader in 2015 when they banned the flavored cigarettes. That was a big deal, and then as time went on, it became acceptable. But that was done through legislation, not through regulation. The PC bill on the Tobacco Access Act amendment would require that the banning of the flavors would be legislated. And I'm just wondering if you can comment, because the Minister of Health has indicated that they would consider looking at things through regulation. And I'm just wondering if you can comment on how, where in the past the banning of flavored cigarettes was done through legislation, if that's not the strategy that we should be using for the banning of the flavored e-cigarettes in terms of legislation versus regulation.
Mr. Cunningham.
From a public health point of view, the most important thing is the final outcome.
Yep.
What is, whether it's done by legislation or regulation, what is, the outcome? And Nova Scotia has demonstrated it's been a leader as, the first place in the world to ban menthol, and the first province in Canada to ban smoking in cars with kids. Wolfville had done it sort of around the same time. Nova Scotia can be a leader. So Nova Scotia can do things first, and other provinces and other parts of the world can follow.
Ms. Adams.
Thank you very much. All of the steps that you've talked about, we know are not going to ever eliminate the choice to use these things. But in other recommendations that you had brought in, the banning of the flavored vaping juices was number one. And then we were talking about the enforcement of the regulations that are already in place. And we know that we have school policies banning vaping, but the youth will tell us that they're vaping right in the classroom when the teacher turns her back. So I'm just wondering, in terms of an education program in the province of Nova Scotia, I personally, with having 4 sons, haven't seen a whole lot of education for youth on the dangers of vaping. People my age don't appreciate yet the dangers of vaping as a gateway towards smoking. I know that some in the industry argue whether that's even the case. So I'm just wondering if you can talk about the government's current programs to educate youth and parents and even health professionals, because I'm a health professional. There's been zero training for us on how to assess, treat, and report the impact of vaping on anyone in the province. So I'm just wondering if somebody can comment on the province's attempts to educate youth and parents on the dangers of this, and what other strategies we might recommend that they use in order to not need to use these substances, and what more you think that the government could be doing.
Who'd like to take that? Dr. Al-Hamdani?
Yeah, so education is important. There's no question about it. But sometimes as health professionals, we are concerned about overstating the benefits of education without implementing policy. So policy comes first. So if we cut the access point through restricting access to the products in physical retail locations at least, and through minimizing social sourcing through increasing the minimum age to 21, we're already targeting 2/3 of the youth, because about 33% of them access them through retail locations, and another 33% access them through friends. Now, to the point of education, I think the issue and the epidemic of vaping has grown a lot faster than what we had anticipated. I believe that the government acted in good faith in terms of making the product available to see if it may has any potential for smoking cessation. And now that they've seen the impact, I believe that they are going to work towards providing some education in schools, or at least work with health professionals and non-for-profits such as the Lung Association, maybe other ones like the Cancer Society, or even Smoke Free Nova Scotia, in order to coordinate the availability of those educational information, even if it's in the form of brochures or infographic materials, because we have to understand that the industry was able to hook these youth through quick messages, sleek designs, burstful flavors. We need to use a similar light approach where we provide concise information via methods that resonate with them, and I think we can work towards that goal, but more importantly, focus on the policy changes as a primary goal.
Ms. Adams?
Thank you.
Sorry. Okay, Ms. Fonseca?
Yes, and also we want to make sure that education that we bring to youth and parents, it is health promoting. So, we don't want to already target vulnerable youth who are addicted to these nicotine products. So we really want to make sure that, we don't just focus on that individual level and that behavior-based response, but more like social norms and the environment.
Ms. Adams?
Thank you very much. As our ultimate goal is that the kids are not smoking anything that's going to harm their lungs. One of the recommendations, or number 3 for Smoke-Free Nova Scotia and all of the stakeholders, was stronger enforcement is required to prevent the sale to minors, and you alluded to that. I'm just wondering if anyone knows how many store owners have been fined, what kind of enforcement has actually happened in the province. Because when I speak to, police officers and RCMP, they're not spending a whole lot of time doing that. So I'm just wondering if anybody can comment on how much actual enforcement of the laws and regulations is currently happening in Nova Scotia, and how effective do you think that's being?
Ms. Cull.
Certainly, retail density is a huge component of the issue that we have here. E-cigarettes, and particularly ones that are sold with high concentrations of nicotine, are sold in every convenience store across this province, of which I don't have count, but I saw online that there was about 6,500 across Atlantic Canada. And then there's all these specialty vape shops that, most people are seeing in their communities at this point in time. I think one of the challenges related to enforcement is on retail licensing. Right now in Nova Scotia, there is no retail license requirement for vendors who sell e-cigarette products, or a retail license requirement to sell e-cigarette products. In your binder, underneath the pink tab, there's a listing here of some of the retail licensing fees that exist across Canada. These are specific to tobacco. I believe that there are some municipalities that have recently introduced retail licensing across Canada. I think that's an important part of this conversation, because right now, from an enforcement perspective, because of the sheer concentration of vendors in this province, it's really hard to get a handle on that enforcement strategy. I couldn't comment on the efficiency of the enforcement here in this province, but I know that it's done through the Department of Environment. But I think there needs to be it needs to be looked at how we can better control, manage, and monitor the density of the issue. The other piece that I would add here is that right now in Nova Scotia and New Brunswick are the only provinces in Canada that currently have tobacco retail licensing fees, and it costs $42 a year to sell a tobacco product in this province, which I think is quite economical considering the health harms that are incurred.
Ms. Adams, you have about a minute and a half.
Thank you very much. So I guess my last question is, where the incidence of vaping has skyrocketed here in this province, and we want to do everything we can to protect our youth and to stop them from moving on to the path of smoking. The organizations such as all of yours that are dedicated to doing this, this is a greater threat than we ever anticipated. So we need more people fighting the battle. And I'm just wondering whether your organizations have grown along in terms of numbers of people and resources that you have at your disposal, or have you had to divert your attention to other health issues to deal with this? Oh.
Time has lapsed. We'll turn it over to the NDP Caucus for 20 minutes. Ms. Martin.
Thanks so much, and thank you for being here. I have to start out by saying the vaping evening that was put on down the street somewhere, I'm not from Halifax, so down the road, by the kids from high school or junior high was eye-opening for me. I had no idea. And to have them tell me all of these things about all of these different devices was shocking, and they were so well versed, sadly, in vaping. And when we got to ask questions afterwards, one of mine was, how do these kids afford it? But I guess like everything, when there's an addiction, anyway, it was very eye-opening, and I think that form of education or road tour or something would be a great tool if we could do that in high school, if we could do it in schools, because what is the answer? I had a conference call not that long ago with Dr. Strang and another colleague of mine and myself, and we talked about, how involved is the Department of Health in this? How committed are they to blocking the sale and restricting sales or fining the vendors? Because I believe at these numbers that you're giving us, you know, it takes me back to a time when cigarette packages had the gross pictures on them. And 100 years ago in another life, I smoked. And my daughter, who was 8 at the time, caught me, because I never ever smoked in front of her, caught me, and she started to cry hysterically because she was taught in school that if your parents smoke, you're going to die. They're going to die. And she thought I was going to die, and that was enough for me. That was enough. But, you know, so how do we get to that end game? How do we just block it? Like, if this is killing people, how come we don't go back to those gross pictures and all of that information to stop this?
Who would like to take this question? Dr. Al-Hamdani?
I think Kelly has touched on that beautifully already from Canadian Cancer Society. She said comprehensive tobacco control policies are a suite of policies that work best when they're implemented together. So yes, we need to look at different pieces that we can implement in order to reduce the impact of this issue. And if we learn from the lessons from tobacco control, as well as some findings from this survey, we can come up with a number of policies that can effectively bring down youth vaping rates very aggressively. I'm confident about that. And I think I want to stress on one point, because I feel very frustrated sometimes, just even talking to some health professionals and researchers in the area about the true impact of vaping as a smoking cessation aid. There is a systematic review by the Ontario Tobacco Research Unit, and it has concluded that vaping, there's inconclusive evidence on the effectiveness of vaping as a smoking cessation aid, okay? That's systematic reviews tend to look at a summary of evidence of multiple studies. It tends to be the strongest level of evidence that we rely on besides meta-analyses. Now, not only that, if you look at individual studies that impact, on the impact of vaping as a smoking cessation aid, the most promising one from an effectiveness perspective is by Havek et al. From 2019. They showed a 1-year abstinence effectiveness of 18% versus nicotine replacement therapy, which was about 10% in that study. So that was good news for the industry. But if you dig down deeper, what you will find is that 80% of those who quit using vaping or e-cigarette devices, 80% of them continue to use e-cigarettes. So e-cigarettes sustain nicotine addiction. It does not get rid of nicotine addiction. And how many of those who used nicotine replacement therapy, you know, those 10% that quit, how many of them ended up continuing to use these products? About 9%. So that's a true smoking cessation aid. Now, these numbers don't often get analyzed to that deep level, and there's even more. If you look at that group that received nicotine replacement therapy in that particular study, you will find that most of them used nicotine patches in addition to other forms. What we know about nicotine patches is they are what we call a slow-acting, low-dose supply of nicotine in comparison to inhalers. Inhalers will give you a good, strong boost. I'm talking about inhalers that are through the pharmaceutical industry. So had we compared them to a nicotine inhaler, I bet you that the rates wouldn't have been that high for e-cigarettes in comparison to vaping. So you need to look at that level of detail to be able to get a better picture and come up with a better conclusion on the effectiveness of vaping as a smoking cessation aid. Not only that, look at how many people does vaping recruit in terms of smokers. If we look at the evidence, there is, in our study, we found that 20% of youth and young adults with a history of tobacco use and vaping have reported vaping first and then using tobacco. And that's not random. If you look at another study outside of the one that we did in Smoke-Free Nova Scotia, and it's, I believe, from 2019 as well by Berry et al., it shows you that 21.8% of new cigarette smokers have started smoking after vaping. So I'm asking you to be the judge. From one side, there may be, and with a quotation, maybe, there is some effect for vaping as a smoking cessation aid with so many question marks on its effectiveness. And on the other side, we have more conclusive evidence on its relationship with smoking initiation. So even for the one reason that the industry claims this product is available for, it's not really doing its job.
Mr. Cunningham. Mr. Cunningham.
Just to reinforce the importance of a comprehensive strategy. We need a whole series of measures very quickly. And Ms. Cull referred to the 74% increase in youth vaping in Canada among 16 to 19-year-olds in a single year from 2017 to 2018. We don't yet have 2019 data in Canada, but we do for the United States. And the trends are this is in the yellow tab to your binder. And it's gone from 11.7% in 2017 to 27.5% in 2019 among high school students, and among middle school students, it's, I think, tripled. And so when those middle school students become high school students, the concern is going to be it's just going to keep going up and up unless we do something. And that's why we have a whole series of measures that can be implemented urgently in Nova Scotia.
Ms. Cull.
I would just underscore the comment around urgency. There were many of us and many of our partners here seated in this room back in 2014 talking about a ban on e-cigarettes. And the decision at that point in time was to wait for the evidence to unfold. And so here we are in 2019 with a massive public health epidemic. I think that it's appropriate in this instance to introduce as many comprehensive policies that can work together to address this issue in an urgent way. And I think a lot about how this would have looked different in Nova Scotia if we had operated on a more precautionary principle back in 2014 to at least start trying to rein this issue in, because you know, as Rob's shown from the U.S., I suspect that we're going to see a similar trend here in Canada that really regretfully could have been nipped a number of years ago.
Ms. Martin.
Thank you. So I have to presume then that the reason it hasn't been nipped is because it's a big business with big dollars behind it and making lots of money and providing lots of tax dollars, which I find at people's expense is very unsettling. So would you agree then that legislation that we have all talked about and tabled needs to be implemented, and I agree with what you said, you know, whether it's legislation or regulations, we need action and we needed it yesterday. So that's what we need to do in order to contain this?
Mr. Cunningham?
Absolutely. Those measures and others. So there's a series of measures that can be put in place, and you have our full support.
Ms. Martin.
So thank you for that. Have there been continuous meetings or ongoing meetings? I know, like I said, I spoke with Dr. Strang, and I understood him to be the go-between on this issue with the Department of Health. How is that progressing?
Mr. MacDonald.
Yes, there's ongoing conversations with Dr. Strang and with all the officials within the Department of Health that this comes under their purview. From our point of view, the Lung Association, we're going to be proactive. I know we were kind of touching on education and a comprehensive tobacco control strategy. Is that something we should revisit? Potentially, yes. A year ago, we had a tobacco control symposium. We had over 70 stakeholders there from all the departments, as well as from the health authorities as well, which they need to be included in this as well. So yes, we're working closely with them.
Mr. Cunningham.
Just to add, in terms of your prior question about the cause of the problem, and it's very much the commercial interests that can be held accountable and responsible. The major tobacco companies are now the dominant players in the e-cigarette business. So Juul is a corporate affiliate of Philip Morris. The brand Vape is a brand of Imperial Tobacco Canada. The brand Logic is of JTI MacDonald. And so these are companies that have this long history documented in their internal documents. The Supreme Court of Canada says that they have targeted underage youth. They have been the masters of successfully getting kids to start, to replace those smokers who quit or those smokers who die. And so we're troubled we're troubled by what we're seeing. And we're seeing, in a way, a repeat of what was going on 40 years ago with the tobacco companies in terms of their marketing strategies, in terms of their public relations campaigns, in terms of their lobbying. And we've seen how we can put public health first to protect our kids, to respond to these companies their interest is not the health of kids. They need kids as long-term addicted customers. It's very good financially for them. And so we need to be able to respond. We've done in the past, and we can do so quickly once again.
Ms. Martin.
Thank you. It's funny that you say that, because we had a request from both the convenience store group and Imperial Tobacco to appear today to provide information, and immediately our caucus said no, because we believe that that's the problem. That we believe that that's the root of the problem. We don't need to hear why they need to continue to make or sell. We need to hear what we need to do to stop it. So, and I think at the end of the day, it is big business. And sadly, the legislation could come relatively, quickly, I would think. And with that, what role do the schools have in helping this and promoting this? And because I've heard, just since the event down the street, I heard that some kids go into the washroom and vape on their way to another class. Like, it sets me back to when I was in high school and the seniors used to smoke in the bathroom then. So, are the schools involved? Do you have any outreach with them?
Mr. MacDonald, then we'll have Ms. Cull. Mr. MacDonald.
So I too attended that event, the MLE dinner hosted by the Cancer Society, and it was beneficial to us as we had a conversation with the Minister of Education, and we're going to be having a meeting with him to see what can be done and how we can get into the schools. There's a lot of pressures put on the school to get information out, so a strategic approach needs to be done on that as well. Education is very important. This is where our students are, our youth. We've worked with our colleagues in British Columbia, the British Columbia Lung Association, and they've created a vaping toolkit. We're looking at that and modifying it to a Nova Scotia approach where it's focused on not only students, but educating parents and educators as well. So we're in that process, and we're working on that as well.
Ms. Cull.
As you know, the Cancer Society, we have and continue to work very closely with the students at Millwood High School, who I agree with your sentiment were very, very impressive and continue to be very, very engaged on vaping and tobacco. We will continue to work with them to move some different things forward over the course of the coming months. I have two things to add to what you said. The first is that I've had some conversations with some of the administrators, just specifically at Millwood. I don't envy their position. I think that this has been a very, very challenging issue for them to try and regulate and for them to try to address from a cultural standpoint in their school. And I certainly think that that the administration there is really grappling with some of the best ways to deal with this very challenging issue. You've talked about how these products are slick and they're highly advanced and they're to a certain extent very undetectable, which does make it very, very difficult for them to manage in the school environment. I can speak to Millwood specifically. They have put a couple of pieces in place. I think that they have shown a lot of leadership in terms of managing the school environment to be safe and to be healthy and to be smoke-free. So I certainly think that there's opportunities for schools to find ways to better manage their own student environments. On the educational piece as well, I would add that, I agree with what many across the table have said, is that this isn't an issue that we're going to educate our way out of. I don't think that we can overstate the addictive nature of these products. It's hard to compare apples to apples, but many would say that a lot of these high concentration e-cigarettes can be contain 2 to 3 times the amount of nicotine as an average cigarette. These students, and I've met several of them through my time with Millwood, but are highly addictive. I actually met one student who was in the process of trying to quit e-cigarettes, who was in the youth health center trying to access some support, but shaking violently after 24 hours of withdrawal on these products. So I really don't think that you can understate. My point is, These are highly, highly addictive products. Educating someone out of an addiction is just a really simplistic way of looking at these products. This isn't, this is more than, educating around the food guide or eating healthy or exercising. This is talking about a product that is really impacting someone from, in terms of their brain development, in terms of their body chemistry. And so I think that we need to really account for that type of addiction when we're talking about education. And just to echo what my colleagues have said is that I think education really comes as a complement after we establish good comprehensive policies in our schools. I also think that an opportunity in terms of education is to talk about this in a way that denormalizes some of the industry's approaches. I think that we have to be really, really thoughtful about the way that we approach young people on this issue. Through my conversations at Millwood, I've learned that students don't like being talked at, they don't like being talked down to or lectured. I think that there's an opportunity to talk to students in a way that really educates them on how this vaping industry is specifically targeting them through advertising, through product design, through nicotine levels, and come at it from a lens that's more peer-to-peer as opposed to kind of top-down.
Thank you. A reminder for guests in the gallery, there are no photos, nor are you to lean over the railing or near the railings. Ms. Martin.
Thank you. Thank you. So it kind of flies in the face of why I understood e-cigarettes came out was to help with quitting smoking. But now if the levels are double or triple, well, I guess they don't have to justify once somebody is addicted to them. They don't need justification on why the tobacco is higher. But looking at your recommendations as a comprehensive plan to get to an end game or to reduce 5 to 2035, have you presented this to government? Like, is there any uptake? Like I said, you said there shouldn't be party lines to this. Money shouldn't come before people's lives, and money shouldn't come before young people, let alone anybody. But, what's the problem? Why can't we sit down, have a conversation? Let's look at how we implement this into legislation to protect the youth and the adults that continue to do this. Has any conversation happened like that?
Who would like to take this? Ms. Cull, you have 1 minute.
The Canadian Cancer Society, and I know many of my colleagues have had conversations with the Minister of Health and with several people within the Health Department, and they are certainly aware of and have been presented that comprehensive suite of recommendations. Our key message to those stakeholders has been, if we just do one thing, if we just do, for example, a flavor ban, we're going to see an opposing response on the other side. So if we're going to look at this in a serious way, and if we're going to look at addressing this in a meaningful way and really move the needle, then we need to have a balanced approach to whatever this legislation and regulations look like, so that we're not seeing, doing one thing and creating a different issue over here. The industry is very adept at creating loopholes and exploiting loopholes and opportunities. And so we need to be as thorough and careful and as meticulous as possible.
Ms. Martin, you have a couple of seconds.
Thank you very much. As always, your information is just mind-blowing, but
Order.
Welcome.
Time has expired. We'll hand it over to the Liberal caucus for 20 minutes. Mr. Irving.
Thank you very much, Madam Chair, and I want to thank our guests, first of all, for writing this committee several weeks ago and asking to be part of our agenda, and we were very delighted to give up one of our agenda topics for this, because as you have outlined over the last 40 minutes, this is an extremely important issue that is going to take a concerted effort by everyone, I think, to get at. And I did want to also thank your three organizations over the years. Nova Scotia has led not only by successive governments, but also by organizations like yours that have kept the topic at the forefront and allowed Nova Scotia to be a leader. So thank you for all of that. I want to begin with a couple kind of technical questions as we, as legislatures and as Nova Scotians kind of understand this issue. And I was just wondering, are there any secondhand harms to vaping that led our initial attack, I think, at tobacco use was secondhand smoke. Are there secondhand harms with respect to vaping that we should be aware of?
Mr. Cunningham.
Yes. So the vapor, secondhand vapor, is not just water. There are some harmful substances in that, and Nova Scotia and other provinces have banned use of e-cigarettes where smoking is banned. It's less harmful than secondhand smoke, but it's not harmless.
Mr. Irving.
Thank you. And in terms of these nicotine levels, these high concentrations, and you've answered my question that is 2 or 3 times a cigarette. Now, does that really affect the addictive properties of this product, or are there corresponding health issues exacerbated when you've got those higher concentrations of nicotine?
Mr. Cunningham.
The rates of youth e-cigarette use in Canada and the United States are enormously higher than, for example, in the United Kingdom. And a big difference is there they have a maximum nicotine level of 20 milligrams per milliliter. We don't have that here. And so I think that's an important explanatory difference between the trends. And so it's very much a factor with respect to addiction.
Mr. Irving.
But in terms of us having the health effects of cancer creating, presumably with higher concentrations of nicotine, it's beyond the addictive properties, it's damaging health, and maybe the doctor can help us here.
Okay. Dr. Al-Hamdani.
So the most important issue when it comes to nicotine is that it's the hook. It's the psychoactive substance that perpetuates the addiction. But vaping comes as a package. It comes with the average of 41 cytotoxins or toxic components that come with it. So as long as you vape higher concentrations of nicotine, you're very likely to sustain that addiction and thus continue to absorb those chemicals along with it. And although we haven't seen any specific literature, or at least it's mixed when it comes to the health effects of nicotine on its own, if you look at some of the effects that we're seeing now in the US when it comes to vaping in general, there are over 2,000 hospitalizations and close to 40 deaths. And that's telling us that vaping is far from being benign. And the second important point comes back to how many people started using tobacco as a result of starting vaping first. Vaping is a gateway to tobacco use, according to some evidence, and those people who start using tobacco after vaping will get exposed to tobacco smoke and will inhale tobacco smoke and get all those harms that comes with tobacco smoking.
Mr. Irving.
Thank you. And just returning to a comment by Ms. Cull with respect to this battle that we are about to wage with the producers of these products in terms of a comprehensive suite of approaches. I'm just wondering whether there is any evidence or concerns around a black market. Is there a black market that exists for this product, or have actions been taken that have resulted in a black market? Is that going to be part of these actions, this discussion over the next 5 years, is the development of a black market around that, and should that in fact be part of the considerations of the actions that we take?
Mr. Cunningham.
So I'd say right now there's not a black market. I think if there was to be a total ban on e-cigarettes, that would create issues and there'd be illegal sales. In fact, e-cigarettes with nicotine were illegal in Canada until the passage of Federal Bill S5 in May 2018. Yet they were everywhere. And they were in vape shops, and the Health Canada was not enforcing the law. So if there was to be a ban, there would be a black market, an illicit market. We're not proposing a ban. E-cigarettes are intended for smokers unable to quit. They should be available for smokers. What's not supposed to be happening is this incredible youth use, and we need to tackle that.
Mr. Irving.
With respect to what's happening in other jurisdictions, and I understand that these are early days, I guess, are there actions that have been taken in other jurisdictions that have been particularly effective? Are there lessons learned in these initial days from other jurisdictions that help us prioritize the actions that we should be taking?
Mr. Cunningham.
Thank you. So I think yes. We know from the evidence that age 21 works. The Institute of Medicine report, but there's been subsequent studies since then. And it's very transferable, among e-cigarettes and smoking. There is the European Union experience with the maximum nicotine level. We know it has worked from tobacco control after decades of practical experience and studies, and there's a parallel in our recommendations.
Dr. Al-Hamdani.
And I'll add to that also, any evidence that we've seen from tobacco can essentially be applied to e-cigarette or vaping control when it comes to policies. And I was waiting for someone to mention it, but taxation in tobacco control has been shown to be the most effective policy in terms of reducing tobacco use, no question about it. And not only that, the good thing about taxation is that it would decrease youth vaping rates disproportionately in comparison to adults. So more youth, the higher percentage of youth are going to quit if we implement taxation in comparison to adults, because that's what we've seen from tobacco. And the broader economics literature tells us that youth are more price sensitive, meaning the higher the price, the less the affordability specifically for that age group. So again, we can look at tobacco control, and everything that has worked with tobacco control is very likely to work with vaping. What's not acceptable is for us to wait and say, let's see what will happen, because we did that with tobacco. And some of the evidence that came in the 1950s on the link between cigarette smoking and lung cancer, the link between those two came very late, because for the following 3 decades, nothing happened but skyrocketed lung cancer rates and increased lung disease and a host of other diseases that increased. And even though we were working on policies to try to reduce that trajectory, it took us another 2 decades to be able to do that. So we can't wait.
Mr. Irving.
Thank you. And I'll ask just one more question before turning it over to my colleague. And I don't want this question to be construed that in any way I don't sense the sense of urgency here. But I am interested to know, is there more research that we need, or can you talk about how much research is going on right now? Is there more information that would help inform us that's underway, or there's gaps in our information? Again, we want to be taking actions that are going to work and be effective and prioritize this. And Dr. Al-Hamdani, sorry, you alluded to, we have a lot of knowledge from our battle with cigarettes. So maybe my question's misplaced, but is there research that would be helpful here?
Was that a comment or a question?
That's a question. Is there particular research that we really need to help us here?
Mr. Cunningham.
Two-part answer to the question. Do we need more research? Yes. And there's research about e-cigarettes coming up practically every day, or certainly every week. And there's lots happening in North America. And we can benefit from that. At the same time, we have more than enough information now in terms of our being able to respond with a whole series of measures. That research and surveillance can be ongoing to supplement and to go to a further, refinement of policy requirements. So, two-part answer to the question: do we have a need for more research? Yes. Do we have enough information to act now? Yes.
Okay, Ms. Di Costanzo.
Thank you. Thank you, Madam Chair. And I really thank you for the information, but I wanted to start by thanking actually Ms. Kelly, who came to my office back last year in the summer. And I hadn't really thought about vaping at all, or my daughters are in university, so they didn't go through vaping in high school. So I literally did not know about the product until I hired a student in the summer and he was vaping. And I said, what is this, right? So there's a big generation gap where parents don't really know. And until I have grandchildren and then they aren't, then it would be something that I'm interested in. So I really don't think the public has been aware enough in knowing that this is such an important, but it's coming. The session that you did with the student, that was a big help, but I wish more people could have seen it. So we need to advertise or to do something to reach the larger. So I'm listening here, and I have a meeting with my parent teacher from the Park West School. So I put it on right now, so make sure you speak to them so the word comes out for the youth and for the families. But I truly thank you, and I think Nova Scotia has always been a leader in many things, especially tobacco, and we will. I just think with your help, and I actually remember hearing Mr. Al-Hamdani on the radio, and I had just spoken to the department the day before. Where are we? What are we doing? I've been nagging, trust me, since I've met with you, I've been nagging on this subject, and all the 5 things they talked to me about were all what Mr. Hamdani said on the radio. So I was very happy that they're looking into all 5 items that has been brought to the attention. So I'm confident that something will come up soon, but they are targeting all. And as he said, and for me, it's very important that taxation is one of the items that we look at, because I was surprised from the information that vaping is half the price of cigarettes. I believe that's what you mentioned, some figures on the radio that is, and if you can maybe enlighten us about the price of vaping compared to cigarettes.
Dr. Al-Hamdani.
So these are, of course, approximations to the best of our knowledge based on the information that we received. So if youth are telling us that they vape about just over 600 puffs, that translates usually into 3 pods, which have the equivalent of about 3 packs of nicotine worth of cigarettes.
Excuse me, I ask that people do not lean on the railings, please. Sorry, Dr. Al-Hamdani.
So we estimated that 3 pods would deliver the amount of nicotine that 3 packs of cigarettes would. And we asked the same youth, how much do you spend on those pods? And that was about $24.30. Now, if you go and buy any 3 packs of cigarettes, the cheapest brands, you'll at least pay around $48. So for the same amount of nicotine, approximately, e-cigarettes are half as expensive as tobacco. And part of that has to do with the fact that they only have HST and not specific taxes like tobacco does. And that's where we need to have more taxes to make them a little bit more expensive so that the affordability can go down when it comes to youth specifically, at least, yeah.
Ms. D. Costanzo.
Thank you, Madam Chair. It's not just the price, but it's also the education of the harm. We've been very good at, conveying that tobacco isn't the stylish thing in the puffs, in the 1950s and in the movies and other things, that we need to show that this vaping is a very negative thing. And I think that our teenagers that look at this big amount of steam, is it? Or it's not smoke, is it? Steam? Vapor. To me, is when it comes out, it covers the face. It's just a very not pleasant to look at. But, we just need to make sure that these images are negative. How are we doing with that?
Dr. Al-Hamdani.
So I always say, and I've even published on this, I hate calling it vaping. But I use this term because that's the term that everybody understands. It's not vaping. Vaping is, water vapor is vapor. This is not vapor. This is propylene glycol based for the most part, along with 40 other chemicals at least. So it should be called something maybe like cloudy matter. That's what I refer to it. But how many people will look at me weird if I tell them cloudy matter, right? So we try to use some language that people would understand. It's unfortunate. Now, I'm sorry, I'm jumping back to answer part of Mr. Irving's question, if that's okay, because he's asked specifically about harms. Now, we didn't, of course, ask youth in this survey about materialized harms or diagnoses, but we asked them whether they've experienced any side effects, and 14% of youth between the ages of 16 to 18 said that they've experienced side effects. We asked them, what did you exactly experience? And it was an open-ended question. We heard things like shortness of breath, I can't breathe anymore. I think, and for those that use both tobacco and vaping, or used tobacco in the past, they said quitting tobacco was hard, but quitting vaping seems to be harder. And I'm paraphrasing a little bit here. And out of those 14% of reported harms, 73% were respiratory. So we're starting to see some correspondence with what we're seeing in other jurisdictions. It's far from being definitive, this particular finding, but it certainly calls us to go and look for more research, as Mr. Cunningham has alluded to, in terms of specifically looking at which harms we need to focus on.
Ms. Cull.
To touch on your point around product attractiveness, I suppose, I think that this is an area specifically where there's a lot to learn when you compare vaping products with traditional cigarette products. There's been a lot of work, particularly in recent years, around things like plain packaging, around health warnings, really trying to drive down a lot of the attractive components of tobacco products. And if you juxtaposition that with, under the orange tab in your binder, there's a printed photo, a color photo of some e-cigarette products that were recently purchased in Nova Scotia. But you'll see here this stealth pink e-cigarette. And part of the reason that our proposal contains regulatory authority over product design is to really get at issues like this. We shouldn't have e-cigarette products that are colored pink. Some of my students at Millwood have talked about the fact that there are new e-cigarette products coming down the pipe that are in each of the iPhone colors that they're looking forward to. You're starting to see this product design and evolution that is really, really speaking to and targeting young people. So we would urge government to look at having regulatory authority over how these products look and feel and how palatable they are to young people. Particularly girls is, I think, the trend that I've certainly been seeing, just anecdotally, is a lot of products that are specifically targeted at young females.
Mr. Cunningham.
To reinforce Mills Cull's point and your question about education, there's all of these things out there that are undermining education. So the low price, the attractive colors, the easy availability, the flavors that are enticing. And so legislation in itself is education. So when we had mandatory seatbelts, that really informed the public about just how important it was. We increased the age to 21, that sends an educational message as well. All of these policy measures are important for education. And just quickly, Mr. Irving, with respect to your question on research, I just want to acknowledge the research done by Dr. Al-Hamdani and Smoke Free Nova Scotia. It's very beneficial, I think, for your consideration of potential measures for this province.
You have 30 seconds. Ms. DiCostanzo.
Maybe I'll come back later. I have just to see what your vision is for how it should be sold and what the stores look like. Where is the limit that you were hoping for the sales of the item as well? But we can come back to that after. I don't think.
Okay, Mr. Cunningham, we've run out of time. It's now the PC Caucus. Mr. LeBlanc.
Thank you very much, Madam Chair, and thank you very much for coming this afternoon. And I appreciate your insight and your knowledge on this important topic, which is become a public health epidemic across not only Nova Scotia but across Canada. And it's evolved quicker than expected, unfortunately. Our youth are a very vulnerable population and shouldn't be inhaling chemicals that are with unknown effects that are later affecting their health. Our caucus is very concerned for this and for the health of our youth, and we want to protect our youth, and that's why we introduced legislation, Bill 167, very early in the fall session, with no subsequent action from the government other than a promise from the minister to look at possible regulatory action. And a month later, we haven't seen any timelines. We cannot afford to wait much longer for either the federal government to take action, and I echo Mr. MacDonald's point that we need to take action now. There are plenty of findings, plenty of instances documented regarding injury and illnesses across Canada that we have enough information to take action, and we do not have to wait. And I'm blown away at the findings of the survey that's been presented. And I'm glad that we can agree that tackling the flavor ban would be most beneficial to moving ahead on this initiative in Nova Scotia. And I believe that, again, like it's been said, we have an opportunity here to be leaders not only in Canada but across the world and taking action similar to the tobacco action that was taken years ago. I guess I'll start asking Dr. Al-Hamdani, speaking to the contents of the cloud matter. You mentioned propylene glycol, glycerin, the nicotine effects. You've spoken about the effects of nicotine on our youth and related to their brain development and addiction. But can you speak briefly about the other contents at all, or?
Dr. Al-Hamdani.
So it really differs from one product to another. You have essentially 4 different categories of vaping products. Ones that look exactly like a cigarette, others that are called a vape pen, essentially look like a pen. You can refill the e-liquid. Then you have tanks, which are thicker and adjustable knob. You can adjust the amount of chemicals that reach the human body. And then you have the disposable cartridges and pod products. Juul, Stealth, and many other brands have emerged from that. Now, it depends on which product and which type of juice that is in there. Now, in terms of which chemicals specifically might be causing the harm, that is a very difficult question to specifically answer, because even when you're talking about flavor, cherry from one brand means 5 different chemicals from cherry flavor, and another brand which could actually be made from 15 other chemicals. I've seen some very interesting research from Ontario, from my colleagues in Ontario that have looked at that. But the idea is that overall, we do see that people are landing in hospitals, people are landing on ventilators, and the CDC itself now is trying to figure out the reason behind that. Now, they've come up with vitamin E acetate as a potential candidate. That is a supplement. Vitamin E acetate is usually a supplement that's used on the skin or in food supplements, and it's safe to use in that way, but it's not supposed to be inhaled, and it could lead to lung inflammation and lung effects. But I want to point out that they've tested 29 biological samples from 2,000 cases, so it's still very early to identify the specific chemical that is the culprit. And not only that, yes, 100% of those 29 biological samples contained vitamin E acetate, but 82% contained THC and 62% contained nicotine. So it could be one, more, or a combination of others, and they're still working on trying to identify those specific chemicals. But as a whole, they have a tendency to be harmful.
Mr. LeBlanc.
Thank you, Madam Chair. When we look at the healthcare delivery and the current state of our healthcare system, we often alluded to or discussed it as being in a healthcare crisis. And I think moving forward, there needs to be a very strong emphasis on prevention and preventative care. So you've alluded to hospitalizations and things like that. So what are the potential risks and costs to our healthcare system here in Nova Scotia and in other jurisdictions if we do not take action immediately on vaping?
Dr. Al-Hamdani. Danny.
So if we use the approximation of a conservative approximation of one of the potential negative consequences of vaping, which is to recruit 20% of smokers, just look at how much tobacco is costing us per year, and add 1/5 of that cost, and that would be huge. That's millions. That's in the order of millions of dollars in terms of healthcare costs, and that means an additional 20% of tobacco-related consequences: lung cancer, COPD, heart attacks, liver cancer, pancreatic cancer, many other types of cancer, osteoporosis, and you name it. The list is endless when it comes to tobacco use. So only focusing on its tendency to initiate smoking is sufficient, but also trying to understand that it does have some potential to impact the rates of hospitalizations, as we've seen in the US, is a secondary and moot point in comparison to its smoking initiation effect.
Mr. LeBlanc.
Thank you. I believe Ms. Cull alluded earlier that we should either legislate then educate, but I think we should regulate, I believe that you had said. And then Ms. Fonseca alluded to, spoke a little bit about the education piece. So can Ms. Fonseca, can you explain what should be included, when it should be included, and where? So if it's a junior high, and different platforms, for example.
Ms. Fonseca.
Thanks. I was alluding more to whatever education that we are going to be doing, making sure that it's not stigmatizing to youth who are currently using these nicotine products. So helping and supporting them to access nicotine cessation programming. When it comes to timelines and education protocols, I think, Kelly, would you be? No? Okay. Well, yeah, I think it would be or Mo, yeah, you think so? Better than, I think it should be targeted to younger youth, like junior high would be good, as well as, you know, older, all really, and parents as well, a holistic kind of approach to everybody in the environment. So, you know, not just the students, but those all around them as well. Society.
Mr. LeBlanc.
Thank you, Madam Chair. Your organizations work within, obviously, a budget. Since this issue of vaping has come to the forefront, how has that affected your operations, I guess? Have you been allocated more money, or are you guys taking away from other initiatives or other projects that would equally need as much attention, but now, since vaping is very predominant in the forefront, I guess, how's that affecting your organizations?
Mr. MacDonald.
We've made tobacco control our #1 priority. We see vaping falling under that, so it remains our #1 priority. There are other, obviously, other issues that we have to deal with when it comes to lung health, whether it's COPD, lung cancer, lung transplant, which we've seen movement on in the spring from the government, and it's really been a big help to lung transplant patients. But yes, our donors have indicated that this is an issue to them and that they want us to be focused on it. To the education part as well, we have teachers contacting us on a weekly basis saying, what do I do? So people are coming to us, the media, to the point of getting the word out. And in recent times, we've had over 40 media pieces earned in the last probably 4 months. So it's becoming a more the topic of the day. So we have to put our resources into it, and we'll continue to do so. And that's why our partnership, again, with Smoke Free Nova Scotia is vitally important, and our partners here. It makes the work lighter when you have many hands.
Ms. Gull.
Advocacy is a core part of the work that's done by the Canadian Cancer Society. We do advocacy related to all aspects of the cancer journey, everything from prevention to palliative care. But we're particularly passionate about prevention because of the opportunity that it has to reduce the cancer burden for future generations. And tobacco is and has for many years and will continue to be for many, many years the biggest preventable cause of cancer here in Canada. So it's a critical investment on behalf, in terms of the Canadian Cancer Society, and it's something that we feel is really, really important if we want to work in an upstream way and really move the needle on reducing tobacco and vaping rates.
Mr. LeBlanc, you have a little over 30 seconds.
All right, thank you. Dr. Al-Hamdani, can you speak briefly about the methodology of the survey, the 670 participants?
Dr. Al-Hamdani.
Online survey using a system called Qualtrics, advertised through Facebook and Instagram to better be able to reach respondents in the survey, and quite representative of the province, but with a high concentration of HRM by virtue of having high density of shops in HRM.
Okay. Mr. LeBlanc.
Is this something that you look to repeat in the future, this type of survey?
Order, time has lapsed. We'll hand it over to the other LeBlanc, Ms. LeBlanc, for the NDP. 11 minutes.
Small b LeBlanc. Thank you very much for being here. I find this conversation like both infuriating and also really exciting because of the potential and how it seems so easy in a way to bring in these recommendations that you've presented us with. I mean, sometimes I just don't understand what the holdup is. So thank you for making it so concise. And the first thing I want to do is kind of follow up on that advertising thing. Like I'm just looking at this picture. I'm not allowed, I don't know if I can I do this for the people at home? I don't know. Anyway, this picture, and I look at that and it's like, this to me looks like perfume, right? These little glass bottles look like perfume. This looks like makeup, like a nice, sleek little lipstick. And I don't know what this looks like, but then the words, the brand names are Fruit Bay, Naked, what is that one? The Stilth, and Chill. Like how cool are all of those things, right? You just want to have some Fruit Bay in your life. And it's really disturbing. Like as a parent of 2 elementary school kids, I'm like, okay, I feel like I need to have this conversation tonight with them because before I know it, they're going to be, you know, encountering these products and it's terrifying. But I remember when I was young and reading my Sassy magazine or whatever it was I enjoyed when I was in junior high. But I'm sure that there were advertisements for, you know, tobacco and also alcohol in those magazines. Maybe, you know, maybe not that magazine, but something a little bit for older kids. And those are not allowed anymore, right? Like you don't see that anymore. And so I'm just wondering about the advertising and you were mentioning about like, you know, having regulatory control over what these products look like. So some of that is provincial, but is some of that federal? I'm asking, this is a question I'm asking, and if so, I feel like advertising laws are federal, and if so, are you working with the federal government and your organizations at a federal level to work on that aspect of it, or is that less of a priority than sort of getting these sort of provincial regulations in place?
Mr. Cunningham.
So yes, so Nova Scotia has done a good job in terms of retail stores, banning displays and advertising within retail stores, with an exception for specialty vape shops. And we support that. In specialty vape shops, you can have displays. But federally, there's a gap in terms, and we have urged the Federal Minister of Health, Health Canada, and Health Canada has consulted on draft proposed regulations to further restrict where advertising can be. Right now, it's possible for there to be e-cigarette advertising on television, on radio, on billboards, on social media. There is no actual restriction on the location of ads, subject to provincial laws. And you know, there's a few places in Nova Scotia beyond retail as well. There's some places beyond that are covered in Nova Scotia, but that's a gap. And so we have strongly urged, including a news conference on Parliament Hill on September 19th during the campaign, to ask for regulations as soon as possible after the new government is sworn in.
Ms. LeBlanc.
Thank you. So, as you referenced earlier in the last sitting, both the Progressive Conservatives and my colleague here from Cape Breton Centre tabled legislation, sort of getting at some of these issues. But in the Progressive Conservative legislation, the legislation would have made the possession of vaping products by minors a criminal offense, punishable by fines. I'm just wondering if the witnesses here, if you feel like fines and punitive measures are a part of this story, or do you think that they would be effective, or is it part of the package, or how do you, what's your sense of that?
Ms. Cull?
We support punitive measures, particularly at the retail level. So if there's going to be a punitive component, it should be focused on people on retail locations, for example, that are selling to underage youth would be an appropriate focus for that particular initiative. We know that punitive approaches are not effective in terms of decreasing substance use among young people. We are looking through the lens of these 5 recommendations in particular to change the context, to change the environment, to change the culture and norms around vaping for young people. And we believe that that is really what's going to be effective in moving forward the change that we want to see.
Anyone else? Dr. Al-Hamdani.
I think I'll be more direct with this answer. With punitive approaches, yes, it's only effective when it's at the retail level. It's actually ineffective when it comes to targeting youth. We've seen some of that literature with other types of substances. And there is also the unintended consequence of potentially stigmatizing youth who may end up getting penalized because of those approaches. But we appreciate the passion, and we appreciate the effort by the Conservatives to bring forth that part of the bill. And once again, when it comes to their other part regarding flavor bans, we are completely supportive of that.
Ms. LeBlanc.
Great, thank you. Yes, I was going to say earlier when you were talking about your students at Millwood about, you know, things that get through to young people. It's almost like the best approach, in my experience, has been, you know, explaining to them and really getting them to understand how they're being manipulated by the system or by, you know, by corporate America or Canada. Like, I remember the most convincing or sort of effective thing about not smoking that I ever watched was a movie called The Tobacco Conspiracy, in which it laid out like everything that was going on in big tobacco. And, you know, it just like was like, oh yeah, like who would ever want to be manipulated in that way by a corporation? And it was super effective. So just an observation on that. But I wanted to ask you, where'd we go? Oh yeah, so when we were looking at sort of all the research that we've been given about this issue, we were sort of thought maybe a place to go would be targeting, you know, online sales in the way, like checking for, you know, in the way that cannabis is sold online, so that you know the delivery person has to receive proof of age. But we realized, or we learned that that wasn't necessarily that effective, because in fact that's already happening, and so obviously there's something more to it. And so then we turned our sort of focus onto the age at which tobacco could be sold, or these kinds of products could be sold. And I'm wondering, we kind of thought that in the same way that tobacco or alcohol, I believe, and cannabis cannot be sold to someone who looks under 25 or will be ID'd if they look under 25, that could be a useful sort of regulation in this realm too. And I wondered if you could talk about your thoughts on that.
Mr. Cunningham.
Yes. Some other provinces already have a provision that says that for a customer who appears to be under age 25, you cannot sell unless they provide ID, as opposed to under age 19. Quebec has a ban on internet sales. They've required all sales being a face-to-face transaction, and that would be a good measure in Nova Scotia as well to reduce youth access. Some kids can get prepaid credit cards. Some kids are ordering a bunch and then redistributing within their schools with respect to pods or e-cigarettes. Moreover, for an effective intervention with respect to flavors, banning internet sales would be very helpful. So in Quebec, it's no longer the case that the company, you can't, you know, Pure Later, Canada Post, Federal Express will not deliver to a home address, you know, from a company. It's not perfect, you know, but boy, it's quite significant in terms of the difference. So that would be a helpful measure to reinforce, you know, restrictions on flavors for the province in terms of enforcement.
Ms. LeBlanc.
Thank you very much. So I just wanted to pick up on some of the discussion around the actual health concerns around these products. So a recent study from the Centers for Disease Control and Prevention in the U.S. found that the nicotine content in e-cigarettes has more than doubled in the past 5 years. We've heard this today. Products that started with like a 5% nicotine concentration or more than a 5% nicotine concentration now make up 67% of the market in the U.S. And one of the things that the clinicians in the States have noticed is the increase in cases of nicotine toxicity. As you were mentioning, Doctor, so severe that people are turning up in emergency rooms. There's been 40 recorded deaths. You were talking about the shaking of someone going into withdrawal. But besides these issues with the seizures and the addictive nature of the drug, which, you know, let's face it, are like good enough to, in my opinion, to take serious measures, are there any concerns about the strength of the nicotine that's being delivered through the devices? And would we be less concerned about these potential harms if the dosage was regulated to like a low amount?
Dr. Al-Hamdani.
First of all, I'd like you to just note, you mentioned 67% of nicotine products in the US market constitute the highest amounts that are being used. We found 66.5%. So we're seeing a very similar trend here, which is very interesting. And once again, I would mention that the main issue with nicotine is that it sustains the addiction and it allows for the other chemicals to be inhaled. And that's where we have most of the problems that might be stemming from vaping. And also going back to the point that vaping is related to smoking initiation. So that is huge. We're not talking about 1, 2, or even 10%. We're talking about at least 20% of new cigarette smokers becoming smokers because they started vaping first. So that's a paramount issue that we need to face. Now, if there was no issue with smoking initiation, the conversation would be completely different.
Okay. Ms. LeBlanc, you have 1 second. Order. We'll turn it over to the Liberal Caucus. Mr. Jessam for 11 minutes.
Thank you, Madam Chair. I want to revisit this conversation around punitive damages, and I appreciate hearing the information that we have related to, I guess, not having a significant impact on whether this is reaching our youth or not. And I'm trying to understand that more completely. Dr. Al-Hamdani, can you and Ms. Cull, can you jump into that a little more thoroughly before I continue this line of question? I don't understand how adding to significant fines and, targeting retail outlets, like I don't understand how that doesn't have a positive correlation with keeping it away from youth.
Dr. Al-Hamdani.
So I think there must have been a little misunderstanding here. Punitive approaches towards retail locations themselves or retail shops works, and that's what we expect. Enforcement so making sure that they're actually complying with minors, with not selling to minors, that is important and that is effective, and imposing harsher penalties on sales to minors are also important. That is effective. What I was referring to earlier is the punitive approaches towards youth themselves. So going to youths, and if you catch someone who's underage with a product, penalizing them for in that way, that approach specifically has not been shown to be effective in terms of driving down substance use. However, punitive approaches towards shops that don't comply with minor laws or minor sales laws has been effective. So I hope that offers some clarification.
Ms. Cull, did you have something to add?
Oh, thank you.
No? Okay, Mr. Jessam.
Thank you, through the chair. That is helpful. I guess if there were, like I was surprised to see that what it was at $45 to get a license to sell smokes in Nova Scotia, and we're one of only 2 provinces that has fees associated with distributing cigarettes, and nobody has. Anyway, there's probably something bigger at play here that I'm not seeing right now, and I apologize to everybody for my obliviousness, but like the sale of these products must be embedded into someone's bottom line somewhere along the line. So making it less affordable to incorporate in your business model seems to be a way to cut the snake off at the head, I guess, if it makes sense, like we talk about. Anyhow, what about, I guess, fines associated with people who are distributing the product offline? Like we're talking about, it's not only kids, students that are selling the products or getting it from their older brother, sister, what have you. What about targeting that, like they're dealing, so to speak? Like what impact would finding that or repercussions on those individuals have?
Mr. Cunningham.
Certainly would agree that there has to be effective enforcement provisions. Anyone who's supplying to underage, anyone who's doing illegal promotion, anyone who's undermining these efforts, these public health laws, there needs to be effective financial deterrents and fines. And with respect to licensing, why is it the way it is? I think it's just a historic anomaly. And I think we just put our attention to it. I mean, in terms of fiscal responsibility, cost recovery, I mean, if a restaurant or a bar has a liquor license, there's a meaningful annual fee for the license, but we just haven't done it for tobacco. So I think it's a simple catch-up. Many municipalities have done it in Ontario and Alberta, and we can easily do that in Nova Scotia.
Mr. Jessam.
Thank you for that, and that's it for me, I guess. I just wanted to have some further clarification on that. Ms. Miller is going to jump in now.
Ms. Miller.
Yeah, thank you. I can tell you that this has been one of the most informative sessions that I've ever been at, and it's really nice to be back in committee again because we do get so much information. I was part of that Law Amendments Committee in 2014, and I know my fellow members of the opposition here, they came after that point. I think 3 of us were here at that time. I remember the conversation then about, banning flavors and all of this, and it was so new to everybody. Nobody knew really what to expect or whatever, and there was so much opposition. And I think you'll have to agree. I know some of you were in the room at that time too, and not realizing the effects. And so when I'm thinking now, I'm just thinking, wow, hindsight's 2020, and what a different story would have had today if we had gone forward with that instead of using recommendations from that to change that final recommendation in law amendments. And I really wish that had been a different story at this point, but like I said, it is 2020. So, but now we do know that we're looking at several options on how to reduce youth and adult vaping, including regulating the e-flavor cigarettes again, and licensing for sellers of vaping devices and e-liquids. So I think that, with all the information that we do now have, government is taking a stronger look at this and seeing now, whether we go forward with that or how exactly we go forward and address this. But your comment earlier about the student that was shaking, coming off of his addiction to the vaping fluids, it kind of makes me wonder, do the bulk of teenagers even get the fact that these are addictive substances? Do they still think it's just flavored water, that they're not, is it a lack of information on young people now in a lot of that gets them going and then becomes addictive?
Ms. Cull?
I certainly think that that's been part of the evolution in terms of this conversation. I suspect that if you were talking to a group of high school students 3 or 4 years ago, the general perception would be that these products were benign, that there was no health harms. I mean, to the extent that in some ways they were promoted as almost health promoting. And that conversation has changed dramatically, particularly with the passage of S5 and the legalization of e-cigarettes that contain nicotine. We've gone from e-cigarette products being viewed as more benign or not health harming to having products that have very dramatic escalation in terms of their nicotine content. And so I think that we have gone, what I've heard particularly from a lot of students is that they'll start e-cigarettes at a very low nicotine content level at 5 milligrams per milliliter, and then gradually move their way up until that they're reaching that maximum legal level of nicotine, and in some cases actually jimmying together even stronger levels of nicotine so that they can sustain that addiction. And part of that really comes from the efficiency, again, of these products and their effectiveness in delivering nicotine. It's very smooth, it's very easy to inhale, it's very, very palatable for young people. So I think that there is a high level of awareness of the addictiveness of these products because there is such a large amount of student population who is dealing with that addiction, who can't get through an entire class without going outside or getting a hit or having had this, whether it's these physiological impacts. I have one student who is a soccer player, and she really directly felt the impact of being able to run and being able to perform, or you know, there are certainly other instances in terms of memory and concentration. Anxiety is something that I've heard a lot of students talk about in relation to this as well. So I think there's been a big evolution in terms of how these products are perceived by the student body. I don't think that there's a lack of awareness among young people, quite frankly, around how addictive they are at this point in time. And that's why I think all of us here have underscored the importance of policy either in tandem or before education if we're going to get at this in a meaningful way.
Ms. Miller. Oh, sorry, Mr. MacDonald.
I was just going to add to that as well. We've seen an incident in St. John, New Brunswick, where a teenager, she was coughing up blood. It was on the news, and again, it highlighted some of the concerns out there. We've had discussions with her, and I think it's important that the messaging comes from the youth as well. And I think it was kind of briefly mentioned before, and I think there's opportunities there as well, and we need to involve them in this process as well.
Ms. Miller, just over a minute.
Okay, and I guess I won't say too much. That I really want to thank you all for your advocacy of the way you do. Certainly, I agree with the taxation bit. When I was the national president of MAD Canada, we suggested exactly the same thing. You know, tax your alcohol so that it becomes a deterrent to over drinking. And I think that could be part of the solution with this. Again, I think that your suggestions here for your different solutions are all very fact-based and are very good. So we're going to make sure that a lot of this this will all be going back to the departments and be looked at by government. I think it's a very, I'm just so pleased that you were here today and we could take part in this conversation. Thank you so much.
Thank you. I'll ask for closing remarks. Does anyone have any they would like to do? Ms. Cull.
Thank you very much for your time today. I'd like to go back to where I started in terms of what the vision is around these substances and go back to that idea of a tobacco endgame. We really are advocating for a complete phase out of tobacco products in Canada. That's where we want to be, and we want to be somewhere similar with vaping products, particularly when it comes to non-smokers or to come with young people who've never used these products before. I want to talk a little bit also about the different ways that we need to view these products. Oftentimes when we think about substances, we take alcohol, cannabis, vaping products, and tobacco and want to lump them all in the same category and have the same kind of regulation surrounding all of these products. And I would challenge that thinking. We have a different end in mind with respect to tobacco and vaping use. And so that really requires different regulations and different approaches. If we want to get to 2035, it has to be different than the path that we're on today. We are working towards a tobacco-free society. We are not working towards necessarily, I'm not here to argue the validity of it, but we are not working towards a cannabis-free or an alcohol-free society. So we need to think out of the box, and we need to think outside of this kind of comfortable space that we sort of live in around age of majority or age of maturity, and think about it in relation to the long-term health harms and the long-term health impacts of these products. How do we get from here to 2035, and how do we actually drive down these rates to 5%, and be bold enough in our thinking and in our actions to actually take meaningful steps towards that goal. So thank you for your time, and we look forward to working with you.
Mr. MacDonald?
Very similar to what Kelly said. I guess from a lung health perspective, we see on a daily basis those who have suffered dealing and coping with COPD, lung cancer, lung transplant, and that shame that they feel that they did it to themselves, that stigma, if you will, that was just the norm, and it was an addiction. It was an addiction, and we don't want to create another addiction with vaping. We can talk about, are we too late or too soon? I think the time is now. We got to move forward where we're at. I think having this committee meeting today is a great step in moving forward. We're willing to work, and we've shown that, and we'll continue to do so with our partners and with the government. Again, to help avoid the conversations we've had with other people that dealt with lung health issues. Again, thank you for the time, Madam Chair, and I appreciate it today.
Thank you all for coming here and being our witnesses today. We'll take a 2-minute recess, so you may leave the chamber, and we have a bit of committee business, but I'm sure the media is outside waiting for you. 30 seconds, please, before we come to order. I'm soon calling the meeting back to order. Please take your seats, members of the committee. Order. We will continue with our business meeting. If you go to your correspondences, we received a correspondence on October the 25th with a response from the Nova Scotia Health Authority. Everyone did receive that by email? Agreed. Going down September 10th, you received an email, from the September 10th meeting. We had an email received by members on October 31st from the Department of Health and Wellness. I think those were the organizational charts, perhaps. And on November 8th, we received a correspondence from Dr. Todd Howlett on the Telecare 811. Everyone received those correspondences through the clerk? Yes. Okay. We also had correspondence from Duncan Rayner and Temple Scott Associates Limited. It was a request from Imperial Tobacco Canada, and we also had a correspondence from Jessica Crane, Atlantic Convenience Stores. Those were done by polls, and the votes were, there was not unanimous agreement to having them at the meeting. Ms. Adams?
Thank you. I just wanted to make a request perhaps for the Nova Scotia Health Authority. I had requested an updated or an organizational chart for the Nova Scotia Health Authority and the Department of Health and Wellness. And during question period, the Minister of Health had said that they were working on updating because staffing were always changing. And I said I would take whatever organizational charts he had at the time. So I'm wondering if I could request for our January meeting, that would be sort of 3 months since we received it, if we could have an updated chart. So I guess I'm probably will be asking for an ongoing updated organizational chart so that we can be continually updated as to the changing of staff in those various departments. So I don't know whether I need to make a motion or whether...
I don't think so. We'll hear what the clerk has to say. It'll be her work.
Okay.
Well, I can write a letter to the departments on behalf of the committee. If I were going to do that, I think that we would need the entire committee to agree on that. But if the committee agrees to it, I can certainly write to the NSHA and the Department of Health and ask them for this.
So, Mr. Irving.
Thank you, Madam Chair. I may be confused with the request. The Minister of Health tabled the organizational charts in the House of Assembly following the next day after that question.
What Ms. Adams is asking for is a process where we will have continuous updates, maybe 4 times a year or something like that.
Okay, all right.
Which I think is reasonable because we all need them in our offices. If you're doing constituency work, you really need that information.
Okay, thank you.
Ms. Adams.
So I guess I'd like to make a motion that the Health Committee request a 4-time-a-year update of the organizational charts of the Department of Health and Wellness and the Nova Scotia Health Authority.
And for the clerk
And for the clerk to provide that information and make that request.
There's a motion on the floor. Any remarks? Okay. All those in favor? Aye. Opposed? Motion is carried. Thank you. Seeing there is no more business on our agenda, our next meeting will be Tuesday, December the 10th. Our topic will be pharmacists' role in healthcare and the scope of practice. Our witnesses will be Alison Bodnar, the CEO of the Pharmacy Association of Nova Scotia. and we all know who they are. They've always hosted an evening for us, and they always have great information. So being no further business, I would say business is concluded for today, and I adjourn this meeting. Thank you. Thank you for a good meeting, everybody.